What do you know about blood cancer? This term might sound daunting, but it's essentially a condition that originates in the blood-forming tissue. Think of it like this: your body is a well-oiled machine, and your blood cells are the cogs that keep it running smoothly. But when blood cancer enters the picture, it introduces abnormal blood cells that disrupt this harmony. These rogue cells multiply at an alarming rate, and before you know it, they're outnumbering the healthy ones. This imbalance interrupts the normal function of blood cells, leading to a variety of symptoms and complications. From fighting infections to preventing serious bleeding, normal blood cells play a vital role in our health. When they're sidelined, it's like having a football team play without a goalie. So, blood cancer is not a single disease but a group of diseases that can have a profound impact on the body. It's a complex issue, but understanding it is the first step towards fighting it. But what causes blood cancer? This is a question that has puzzled medical researchers for years. While the exact cause remains a mystery, several risk factors have been identified that can increase one's likelihood of developing this disease. One key risk factor is exposure to certain chemicals. For instance, benzene, a chemical found in gasoline and used in the rubber, dye, and drug industries, has been linked to an increased risk of developing certain types of blood cancer. Similarly, exposure to high levels of pesticides or to certain chemicals used in the manufacturing industry can also raise your risk. Radiation is another significant risk factor. Exposure to high levels of radiation, such as that from an atomic bomb or from radiation therapy for a different type of cancer, can increase the likelihood of developing blood cancer. This risk is particularly high if the exposure happens at a young age or if the dose of radiation is high. Infections also play a role. Certain viruses, such as the human T lymphotropic virus and the Epstein-Barr virus, have been linked to some types of blood cancer. These viruses can alter the genetic material of cells, leading to uncontrolled cell growth and eventually cancer. Finally, your family history can affect your risk. If a close relative, like a parent or sibling, has had blood cancer, your risk may be higher. This doesn't mean you'll definitely get the disease, but it does mean you might be more susceptible than someone without a family history. In conclusion, blood cancer can be triggered by a variety of factors, including exposure to certain chemicals and radiation, certain infections, and a family history of the disease. It's important to note, however, that having one or more of these risk factors doesn't guarantee you'll get blood cancer. Many people with these risk factors never develop the disease, and some people without any apparent risk factors do. Although there's no surefire way to prevent blood cancer, being aware of these risk factors can help you make more informed health decisions. Are there signs to look out for? Yes, indeed there are. Blood cancer, though a formidable foe, often announces its presence through a set of symptoms. However, these symptoms are not exclusive to blood cancer and can often be associated with other, less serious conditions. That's why it's crucial to consult a healthcare professional if you experience any of these symptoms. Let's delve into some of the most common symptoms of blood cancer. One of the first signs that people often notice is a feeling of constant fatigue. This isn't just the typical tiredness that we all experience after a long day. This is a persistent, all-encompassing fatigue that doesn't seem to improve with rest. Next on the list is unexplained weight loss. If you find yourself shedding pounds without making any changes to your diet or exercise routine, it could be a sign that something's amiss. Blood cancer can interfere with your body's ability to absorb nutrients, leading to weight loss. Frequent infections are another red flag. Blood cancer can weaken the immune system, making it harder for your body to fight off infections. If you find yourself getting sick more often than usual, or if illnesses seem to linger longer than they should, it's worth bringing up with your doctor. Easy bruising or bleeding is another symptom to watch out for. This happens because blood cancer can affect the platelets in your blood, which are responsible for clotting. If your platelet count drops, you might find that you bruise more easily or bleed for longer than usual. Last, but certainly not least, is bone pain. This can occur if the cancer is affecting the bone marrow, which is where new blood cells are made. This can lead to aching bones and in some cases, joint pain as well. Remember, these symptoms can also be caused by other, less serious conditions, so it's important to see a doctor if you're experiencing any of these issues. Knowledge is power, and being aware of these signs is the first step towards early detection and treatment. What happens to your body when you have blood cancer? This question is often asked, and understandably so. Blood cancer can have a profound impact on your body, and today, we'll explore how it does just that. Blood cancer begins in the marrow, where blood cells are produced. When cancerous cells take over, they push out healthy cells, disrupting the normal balance. This disruption can lead to a host of complications. One of the most significant effects is on the immune system. Blood cancer can weaken your immune response, making it more difficult for your body to fend off infections. You may find yourself falling ill more often, and what would typically be a mild sickness could become severe. This is because your body's army of white blood cells responsible for fighting off diseases is being overwhelmed by cancerous cells. Another significant effect of blood cancer is on the body's ability to produce sufficient healthy blood cells. The cancerous cells crowd out the healthy ones, leading to a condition known as anemia. When you have anemia, your body doesn't have enough red blood cells to carry oxygen to your tissues. This can cause you to feel tired and weak, and in severe cases it can lead to heart problems. Blood cancer can also impact the production of platelets, which are crucial for blood clotting. Without enough platelets, you may bruise or bleed easily, and wounds may take longer to heal. Moreover, blood cancer can affect other parts of the body too. For instance, it can cause bone pain if the cancerous cells spread to the bone marrow. It can also lead to weight loss, night sweats, and other systemic symptoms, impacting your overall quality of life. In summary, blood cancer doesn't just affect your blood. It can influence your immune system, your ability to produce healthy blood cells, your healing process, and even your overall well-being. Blood cancer's effects can be far-reaching, impacting not just the blood but many other parts of the body as well. So, it's crucial to understand these effects and to seek medical advice if you notice any unusual changes in your health. Is there a way to treat blood cancer? The answer is yes. The road to recovery may be challenging, but with the right treatment plan, it is possible to manage the disease and improve quality of life. Let's dive into the various options available for treating blood cancer. Firstly, we have chemotherapy. This is the use of potent drugs intended to kill cancer cells or stop them from dividing. These drugs can be administered orally or intravenously. They work by interfering with the cancer cell's ability to grow and divide, ultimately leading to their death. Next is radiation therapy. This employs high-energy radiation to shrink tumors and kill cancer cells. It works by damaging the DNA within cancer cells, which prevents them from dividing and growing. Though it can also harm healthy cells, they can generally recover from the effects of radiation. Another option is stem cell transplantation. This procedure replaces diseased bone marrow with healthy stem cells that can grow into new marrow. The new cells can then produce healthy blood cells to replace the cancerous ones. This treatment is often used for patients with cancers that affect the bone marrow, such as leukemia or lymphoma. Finally, there are targeted therapies. Unlike chemotherapy and radiation therapy, which can affect healthy cells as well as cancerous ones, targeted therapies are designed to attack specific characteristics of cancer cells, minimizing harm to healthy cells. They work by blocking or turning off signals that tell cancer cells to grow and divide, or by helping the immune system destroy them. The best treatment plan will depend on various factors, including the type and stage of the cancer, as well as the patient's overall health. It's crucial to have open and honest discussions with the healthcare team to understand the benefits and risks of each option and to make an informed decision. While blood cancer can be a daunting diagnosis, there are many treatment options available that can help manage the disease and improve quality of life. Remember, the journey may be tough, but you're not alone. There are countless resources and support systems to help you navigate this challenging path. So, what have we learned about blood cancer? Blood cancer, as we've discovered, is a complex category of diseases that disrupt the body's capacity to generate healthy blood cells. This intricate condition, although its exact cause is still a mystery, does have certain identifiable risk factors that we should be mindful of. It's a disease that can manifest a variety of symptoms, each one as unique as the individual experiencing them. Moreover, blood cancer's impact extends far beyond the symptoms. It has the potential to affect the body in numerous ways that can drastically alter a person's life. But it's not all doom and gloom. We've also explored the array of treatment options that are available today, offering hope to those diagnosed with this disease. From chemotherapy and radiation to stem cell transplants, the medical field continues to advance in its fight against blood cancer. Remember, knowledge is power. The more you know about blood cancer, the better prepared you'll be to recognize the signs and seek treatment if needed.